The morning routine. Creating a daily ritual or habit of moving your joints through their greatest rotational range of motion is very important for maintaining health and longevity of all your joints for the rest of your life. We eventually lose the option to move in certain degrees of motion. Use it or lose it applies to all your joints. Joint health for independence is one of the most important aspects of your health span. This system I will teach you is called CARS, or Controlled Articular Rotations. CARS is like a Swiss Army knife system as it has many purposes, such as maintaining the range of motion of all the joints in your body for the rest of your life. Movement is the most important thing to maintain joint health and longevity. CARS provides this movement. Also, when you get injured, CARS are great for rehabilitation to tell the body where you want the new tissue laid and in what direction to guide the healing process. It's also a great way to check in daily with your body. You deserve this for yourself. And you can screen your joints for damage and tell your healthcare provider when and where the pinch points or issues occur. Irradiation. When we do the movements, we are first going to do something called irradiation. This means we're going to contract or tighten up other muscles in our entire body. This is an isometric movement, which means we don't move, we simply create tension. By creating stability in the rest of the body, it helps us isolate the joints we are working on. Try this. By inhaling and trapping air in your lower abdomen and exhale very slowly through your mouth while activating your core area, and continue creating tension in the rest of your body while moving the joint we are working on. Since this is called a morning routine, we don't want a high intensity and injure ourselves since you are just out of bed. We only want 10 to 30% of maximum effort. So be safe and keep a low intensity. As you draw a circle with your joint, you want to imagine you're traveling through a density of about 30%. For example, create an isometric contraction with your arm and imagine that you're traveling through a density of 30% greater than air, like you're underwater. Go through your greatest rotational range of motion. Always repeat in both directions and on both sides of the body if that applies. CARS provides your nervous system with a lot of information regarding the ability of that joint. The movement must be controlled and avoid moving any other joint. Only move the joint we are using at that time, as often we will try to cheat or compensate by moving other parts of our body. This is the morning routine. Neck. Take your chin into your chest. Take your chin toward a shoulder as if you're slowly scraping your chin on your chest and scrape across your collarbone. Look over the shoulder, tip your ear back. As you do this, try not to hike your shoulder up towards your ear. Remember, especially with your neck, do not push or grind through closing or acute angle pain. Let your healthcare provider or myself know with any joint, pinch point, or pain. You can continue with the rotation, but make sure you skip that segment. Take your chin up towards the sky, try not to push hips forward, then chin back to the other shoulder and all the way across your chest. Remember to look out for pinch points or closing angle joint pain. These are great as a check-in screen to let your healthcare provider where and when they occur during your morning routine. Carve around pinch points and continue fighting for outer range while avoiding these pinch points. A stretching sensation or a light pulling feeling on the open side is okay. Now you can repeat in the other direction. The spine. Remember to irradiate 10 to 30% first. Cross your arms over your chest, try to fold yourself forward, and try not to let your hips and buttocks spill backwards. Now rotate maximally towards one direction and begin side bending toward that direction. Try not to spill the hips to the opposite side as you do this. As you extend back, don't let your hips spill forwards. Rotate to the other side and repeat this in both directions. The scapula or shoulder blades. Again, remember to irradiate 10 to 30% first. Start in a Y position and raise the scapula towards your ear. Try not to side bend your body or tip your head over. Pull the scapula back towards your spine and down towards your buttocks. Don't bend your elbow or arch your spine when you're doing this. Imagine a dot on the deltoid from the side view and create a circle clockwise and counterclockwise. Now draw the scapula forward and then reverse. Try to expand this circle with every repetition. The glenohumeral or shoulder joint. Irradiate the body while keeping the other arm out with 30% tension. By inhaling and trapping air in your lower abdomen and then exhale very slowly through your mouth while activating your core area. You can start with a small circle and try expanding with every repetition. Start bringing your arm forward to where you feel blocked. Remember, try not to hike your shoulder blade or tip your head over or arch your back, and avoid elbow bending. Also, do not grind through the pain, and be careful of pinch points and when they occur. At top or end of the movement where you feel blocked, you wind your arm like you're drying a towel maximally and continue to wind that arm through the entire range of motion. When you arrive at your hip, your palm will be facing away from your hip, pinky facing forward. Then we reverse direction. You start with the pinky forward again, and you will hit another roadblock and wind out maximally like you're drying out a towel from there and bring the arm forward. This is just like brushing our teeth several times a day. We want to avoid joint cavities. The elbow. Remember to radiate throughout the body. Inhale and exhale slowly. With the other hand across your body, touch the inside of your elbow. Start with a straight arm and start to flex your arm and maximally supinate, turning your palm away from your body. Not from your shoulder, remember, but from the elbow. Then reverse this, extending your elbow and bring the palm towards the floor for maximal pronation as you extend the arm or straighten out your arm. Then reverse this. The wrist. When you do the wrist, park your elbow at your side with your elbow at 90 degrees. We want no elbow movement. That's why we create the tension to isolate the joint. Also, imagine or draw an X with a pen on your wrist. This will help you keep it level, or imagine a glass of single malt that you can't spill. Try keeping fingers straight. This one is tricky to do and the range is fairly limited most of us. So you draw a circle with your fingertips, scraping the edges of the movement, and be careful again with the closing angle pain or those pinch points. The hip. Create tension of 10 to 30% throughout the body again. Slowly exhale, embracing your body to isolate your hip. Hold on to the wall or a foam roller or a stick. Bring your knee towards your stomach, as high as possible without bringing your upper body forward, and try not to bend your other knee. Bring your ankle towards the sky like a hacky sack motion. As you open the hip and bring your foot away from your body, try to prevent the other hip from following. Keep your knee as high as you can and start to bring your heel to the sky. When you've reached the maximum of that motion, you can start to extend from your hip and drive your leg back without arching your back and jamming your lower back. Then reverse this. This can also be done on all fours like this. The knee. For the knee, you want to start on a chair or on the floor. Again, you want to radiate the body 10 to 30%, inhaling and exhaling very slowly. You want rotation strictly from the knee and tibia or your shin bone. Avoid any hip movement. You can hug your leg a couple ways, holding with your fingers, or you can use a towel. Turn your foot out externally away from the middle. Hold that position and then straighten your knee. At the end, turn your foot toward the middle and bring your knee towards your buttocks. Reverse directions. The patella or kneecap. Straighten the leg on the floor or a surface. This is not an active movement. You simply want to trace the outer edges of your kneecap by lightly pushing in a circle like every hour of a clock, and then trace in the other direction. The ankle. Again, radiate through the body. Avoid hip, knee, and shin bone movement. You want to point your toes up towards your nose. Put fingers on your shin bone to make sure there's minimal movement there. Now you can gas pedal down by pointing your toe down and inwards. Rotation only from the ankle, not the shin, scraping the edges of the movement. Again, pay particular attention to pinch points and skip if needed. We need a decent ankle range of motion for a squat. The better the range, the deeper the squat. The toes. We want to gather control over our toes. Our feet are impacted negatively primarily due to the shoes that we wear. So start with the smaller toes on the ground and only lift the big toe or hallux up and tap that toe 3 times. Now lift up the little toes and keep the big toe down 3 times. Now all toes up and keep the big toe up, and then tap all the other toes 3 times. All toes up now, then like a piano, slowly take the pinky down towards the big toe. Consider using toe spacers to help increase the space between your toes. This is your morning routine.